Welcome back to the Former Fat Friend podcast. This week we have part 2 of Jamie's story. Jamie Mills, who many of you know as the Sleeved Dietitian on social media, is an award-winning registered dietitian nutritionist. She's a best-selling author, and she is an incredible part of the bariatric community. She chatted with us last week, and we actually had so much to talk about that we had to split this episode into 2 parts. So if you haven't listened to part 1 of Jamie's story, go back and listen to that. It came out last week. She's just incredible, and she's had such an incredible journey, and she has so much insight to share. So we're going to dive right back into part 2 of Jamie's story tonight, and I hope you enjoy. I do want to talk about your experience on a GLP-1 because you started it before you got pregnant. You then went off of it for how long before you got pregnant? Was it a couple of months?
Yeah. So I get that question a lot. Like, can you be on a GLP-1 when you're pregnant? No. So I went on a GLP-1. It was at the beginning of August in 2022. I got home from the ASMBS meeting I had gone to in 2022, learned about GLP-1s, decided I wanted to get on one myself. So I got on one that August, and I came off of it by the following September. So I was off of it. I think it was about 6 weeks. Technically, I think you're supposed to be off of it about 2 months before getting pregnant. But what we did, me and my doctors, is at that point I was like done losing weight. I didn't want to lose more weight. I was focusing on building muscle. So in the months prior, not only did I come down on the dosage, we spaced out the dosage. So I was only taking it like every 2 weeks, and I had gone back down to the lowest dose. So when I came off of it, it didn't even hit me that hard. I just kind of came off. And then I honestly so I was under the impression, because of everything I've been told my whole life with my PCOS, like, you're going to struggle. Like, I was scared to even try to start a family because I'm like, what if it just doesn't happen? So I was under the impression this would take a very long time. So I came off the GLP-1, and then I did get pregnant right away. And you'll hear things in like the media, like Ozempic babies, got to watch out for those Ozempic babies. I think there's some truth to that, so be careful. So I was like, oh. So I wasn't off of it the full 2 months like you're technically supposed to, but I was off of it, and it was definitely out of my system because of the way I titrated down. But that was what I did.
Okay. And then you now postpartum have restarted a GLP-1. What's the experience like? I'm curious, compared to having weight loss surgery, what's it like to be on a GLP-1? Or do you think that it's just a really nice complement to weight loss surgery?
It's a really nice complement because they are different. So being on a GLP-1, the only way I can describe it is like we always say, you had surgery on your stomach, not your head. And while I'm not saying not to do the mindset or emotional work, I think everyone needs to see a therapist and do that hard inner work. But it's almost like this targets the brain piece of it. The GLP-1, I was talking to one of my best friends who we both went on it for the first time around the same time, one of my other weight loss surgery friends. We both went on Mounjaro within like 2 weeks of each other in 2022. And I remember we said to each other, like, wait, if this is how people who don't struggle with their weight feel, no wonder they don't struggle with their weight. It took, so I was on Mounjaro the first time. It took every bit of stress around food out. It took the compulsive thoughts about food out. I no longer was thinking what to eat, when to eat, like worrying about food. I only ever thought about food when I was hungry. Like genuinely hungry, not head hungry, like genuinely hungry is the only time I thought about food. And it hit me one day that this was really working because I had, I'd taken out like a couple of cookies. I think I had like 3 Oreos, which I, was always very mindful. If I'm going to have something sweet, let me portion it out. I had 3 of them. I ate 1 Oreo and forgot about the other 2. In what world is Jamie forgetting about the other 2 Oreos? Like, I walked away from them and forgot. Like, I came back a couple hours later, I'm like, oh, I never ate my Oreos. Because the satisfaction level is so different. So when you have weight loss surgery, you feel full very quickly, and your fullness and restriction you feel. This targets your brain and satisfaction in a different way. The other benefit that I got from it was, and I talked to my therapist a lot about this too, because I struggled very heavily for a long time with body dysmorphia. my body dysmorphia significantly improved. And it wasn't, in my opinion, because I was losing weight and getting smaller. It was because I wasn't worrying about food and therefore wasn't obsessing over my body, wasn't doing like the body checking or, worrying about if my clothes are going to fit or worrying about how I looked, because I wasn't thinking about food and I wasn't thinking about my body in the sense of how it looked. It was like both kind of just went away. Like that anxiety went away, and like the brain space that took up went away. So that was truly life-changing. And one of the questions I get asked a lot is, Jamie, if GLP-1s were an option when you had surgery, would you have been on a GLP-1 instead of having surgery? And my answer to that is yes. I would have had the GLP-1 instead of having surgery. However, I am so glad that that's not the case. And I'm so glad that wasn't the option, because I was so scared of surgery. I was very resistant to it at first. Like I said, I felt very isolated. I had all these emotions. If I could have tried a medication instead of having surgery, that's what I would have done. I'm so grateful that wasn't even an option on the table, because I needed my surgery. And while the GLP-1s are wonderful, I don't think I would have been as successful as, I've been over the years, or had the non-scale victories and scale victories I've had if I did not have the surgery first. Surgery made me confront a lot of struggles. It made me really get the help I needed emotionally. It forced me to learn new habits. I don't think the GLP-1 would have done that. So for kind of what you were saying, the GLP-1, in my opinion, is a wonderful complement. I do think, so surgery numbers are going down. And for certain people, that is a beautiful thing to not have to have surgery if it doesn't need to be so, invasive. So if we can minimize invasive procedures, that's desirable. I do worry, though, just, especially speaking, I'm going to be mindful with my wording. I think that the majority of people who struggle with the clinical obesity really do need both tools. Not all. And, one could even argue that some lower BMI patients might be able to avoid it completely. But if you're talking about someone who has 300 pounds to lose, it's unlikely you're going to achieve what you're looking to achieve with a GLP-1 alone. I really think we need both. And even for myself, like my BMI, I think, was 42 when I had surgery. So still, on the lower end of being like qualified, I guess. I would have chosen the GLP-1, and I'm just glad I didn't, because I feel like the majority of people do need both, and surgery still is the gold standard. So it does like scare me a little bit that surgeries are not going away, but they're not as popular right now because of the medications. And I worry about what that looks like for people long-term. And to clarify, I think these medications are wonderful to be on long-term. They are meant to be on long-term. They can do beautiful things long-term. My bigger concern is accessibility and affordability. And if it's going to help you with all the other areas in that like wellness wheel and holistic view of your health, because not enough people are getting the nutrition guidance and support on GLP-1s because they're not being made to. Whereas with surgery, you have to go through the stages, even though, as we talked about earlier, those stages in post-op diets are flawed and still need a lot of work in terms of support. I do worry that too many people are just under eating on them and not relearning habits that are going to make them not just smaller, but overall healthier.
Yeah, I get that question a lot too. People are like, did you know about GLP-1s? Why didn't you try it? And I had never even heard of them when I had bariatric surgery. And this was just 3 years ago. So they were around. They just weren't what they are today. But I am also glad that I did not go on a GLP-1, in part because one, I think I've been very successful with weight loss surgery, and I'm really grateful for that. And it's a tool that I will have forever. But I also know that life is going to happen. And if I ever start struggling with my weight again, the first thing that I would do would be to seek out help in the form of a GLP-1. And I think the reverse wouldn't be true, right? So if you go on a GLP-1 and you lose a bunch of weight and then you start struggling, you can't then go have weight loss surgery to deal with 20 pounds of regain. Like they don't work. It doesn't work that way.
Because you wouldn't qualify at that point.
Exactly. So I'm really glad that I understand that I have a lifelong disease. It's in remission right now, and it might have a flare up at some point in my life, I think GLP-1s are a perfect solution for that kind of long-term management, whereas weight loss surgery sort of got me that first mile or the longest mile, you know?
100%. And I love the way you like framed that. And I do feel like I think I'm a huge advocate for GLP-1. So if anyone follows me, they know I talk about them all the time. I have a GLP-1 like course for bariatric patients to help people with all the things. Like I love talking about GLP-1s. But I think they have their place in that toolbox of tools that we need to use for obesity treatment. And like I said, like I'm so glad that they weren't presented to me as an option, because they really weren't an option back then, at least not for obesity treatment. And like I don't know where I'd be without my weight loss surgery. I'm so glad that I did things in the order that I did them. And obesity is such a disease, like you said, like it's in remission. It could have a flare up, which like I struggled with that at one point. I had gained about 20 pounds or so back a few years in after maintaining for a while, and that was scary. And that's why I went back on a GLP-1, and I felt, shame again. You know what's crazy? I actually got more hate and negativity for going on a GLP-1 than I ever did for sharing about weight loss surgery. The amount of hate and negativity and backhanded comments I got were specifically from other bariatric patients. I started talking about being on a GLP-1. I'm not going to say I was the first person who like talked about it, but in terms
one of the first, at least from what I saw, I think you were the first or second person that I saw talk about it.
So again, it was, summer of 2022. I think there was a lot of people on them not admitting it. And I remember joking, because I went on stories and talked about it. I was like, it's okay, guys, I'll take one for the team. I'll talk about it first. Which is fine. I understand why people didn't, because again, there's shame. It's like, oh my God, like I need a medication. Like it has its own stigma. So I think I was one of the people that at least has a larger reach and platform who was very honest about it from the moment I went on it. As soon as it got prescribed and my prescription came in, I was on my stories talking about it. That highlight is still saved on my page. And I got a lot of outpour of like love and support, and so many people saying, oh my God, thank you. I've been thinking about this and I felt so much shame. Like, thank you for normalizing this. But then I got a lot of people that were really nasty. They're like, well, if you used your tool right, you wouldn't need surgery. Or like, I remember a couple times specifically promoting some of my like dietitian services and resources that I have, and people saying like really snarky things like, oh, you're gonna, sell your program, but you're on a GLP-1. Okay. Like, and it's like, I'm a bariatric dietitian. I had surgery, and I have my knowledge as a dietitian and my ability to do my job is, separate from from this conversation. Like, people were almost making it seem like, well, you're cheating being on a medication, but you want people to follow your meal plate method. It's like, well, I'm following it too. And the lifestyle habits, that's been the hardest thing to express to people is lifestyle habits, nutrition habits, moving your body and working out. Those things don't go away. We still need to do them whether we are on a GLP-1 or have surgery. Neither is a magic fix. You still need to do the things, especially if you want to do it healthfully. Can you undereat and just rapidly lose weight on a GLP-1 or surgery without doing those things? Yes, but that's not going to serve you long term, as we know. So I got a lot of like nastiness. I got a lot of there's a lot of people posting even like negative things, not directly at me, but like I would end up like blocking or unfollowing, like people saying things like, just you wait, you're injecting all these things. It's the newest fad. Wait till you have a lawsuit pretty soon because you have a disease. Like just like nasty, awful things. I'm like, one, these medicines have been around for 20 plus years with tons of research. They're only just now discovering how great they are. We have the data. Like, I don't know. And I think you and I have talked before about, the average person doesn't always know how to interpret the clinical data. So that was like a frustrating conversation to try and have to.
Yes.
So anyways, I got so much negativity from the very community that I love and try and support so much. So that was really disheartening, but also very eye-opening, again, to how heavy weight bias is even amongst each of us within the community.
Yeah, it's interesting. I do think the tone of the conversation around GLP-1s has shifted over the last couple of years in a really positive way.
It has,
I have seen more bariatric patients on board GLP-1s as part of their journey in the last like 6 months. And it's been amazing. And I truly believe that it should be part of the bariatric program. I don't think it should
be
too. Surgery and then that's it, because there's so many people who struggle after weight loss surgery, and they're made to feel like this was a last resort. This was like their last chance to get it right. And if they're struggling, there's something wrong with them. And I think GLP1s have, at least, from what I've seen, have really changed the game for people in terms of that, where it's like, yeah, bariatric surgery takes you to a certain point. It's not going to take you all the way, and that's okay. You didn't fail. You didn't do anything wrong. You just needed something else. And I really do believe in, let's say, 5-10 years, I think it should be part of a bariatric program.
I really feel like they should be available, offered, or at least talked about to all bariatric patients as an option. Yeah. I cannot wait until more insurances cover them. I cannot wait until cost goes down and accessibility goes up, because that's the biggest hurdle right now. And that's really, really sucky. So many insurance companies exclude them. Like it's a whole hot mess, honestly. But I always tell people, like, the light at the end of the tunnel is this is just the very beginning of a huge breakthrough. And how beautiful is it for us to know that something else exists, that this isn't the end of the road. This isn't the last resort that maybe we thought it was. I just think it's the research behind them is just so cool and so promising.
Oh, it's incredible. And I do think part of the reason why it hasn't, why it hasn't been as celebrated as it probably should be is because it's about obesity, and there is still that bias. And I read this really interesting article, I think it was in The Atlantic, and I forget who the author was, but they were basically saying, if this medication were for any other disease, these people would be winning Nobel Peace Prizes, because this is so groundbreaking and so incredible, but it's because it's about obesity that it's not.
And the biggest thing I've heard, which is such BS, is people are like, you're taking it from people with diabetes who actually need it. And that one kills me. I'm like, you realize these are FDA approved for weight loss too. It's not a war against who needs it more or who's more deserving. And the thing is that, like, I've had to explain to people too, is even before, we had Zepbound, which is like basically Mounjaro, but for obesity. When I was first getting Mounjaro, it was prescribed to me off label, which doctors do that all the time. And this is one of the examples I use to kind of like show that weight bias. When I, my whole life with PCOS and struggles with weight, 2 different times I was prescribed metformin. Metformin is a drug often given to people with type 2 diabetes to help with insulin resistance and PCOS. It's meant for people with diabetes, but it's given to people with PCOS or people with struggles with their weight, just the insulin resistance, and potentially to lose weight. It is super ineffective for weight loss. So like if you go on metformin for weight loss, on average, people lose I think it's 2 to 3% of their weight, which is pretty negligible. Yeah. If you go on Mounjaro or a form of, tirzepatide, so like Zepbound, you can lose up to 22.5% of your weight. Again, huge. Diabetes medication given for things like insulin resistance. But how come we're only mad about the one that works? Yeah, nobody ever in my life prior told me you're stealing metformin from diabetics.
Right.
It's like, we don't care about the crappy one. And I'm not saying it's crappy. Metformin does a lot of good for a lot of people in a lot of different ways. But specifically for weight loss, not super effective, not real great. And people are like, well, the side effects with GLP1s, my side effects on metformin were far worse than anything I've ever experienced on a GLP-1, which I've had very minimal side effects. Metformin wreaked havoc on my stomach. I was on it as a teenager. I was tied down to the bathroom all the time. It was awful. I don't have that on GLP-1s, but you're not worried about people taking that off label. It's such a double standard, and it makes me so mad.
Yeah, it really is. And I do think a lot of this goes back to the stigma of weight, and that, this whole concept of oh, you cheated, so it doesn't count. Cheated who? I didn't cheat anybody else because I had weight loss surgery. Who's being harmed here?
I remember posting about this around the time that my book launched, because this is a relevant topic I talk about in my book. Let's just say, let's just play devil's advocate, and let's just say they're right. All the naysayers who say surgery and GLP-1s are the easy way out and you're cheating and you're taking a shortcut. Let's just, we know it's not true, but let's just say that they're right. Why are you mad that I didn't struggle to lose the weight? Why are you
Exactly.
like, let's just say it's easy. Sure. Okay. You're right. It's easy. Why are you mad that you're mad that you didn't get to watch me struggle and white knuckle it?
Yeah.
Like, okay, let's talk about that for a minute.
Yeah, no, really, it's that we attach morality to obesity, and the only way that you can prove that you're not, lazy, lacking willpower, just a glutton who shoves food in your face all day is by losing weight. But if you don't struggle to do it, you didn't do it right, and then you're still that lazy glutton who shovels food in your face all day, and because you cheated and you took the easy way out. And we would never tell anyone with any other disease that they took the easy way out by seeking help, but it's that morality that we attach to the disease of obesity.
And the thing is, so many other diseases can also, to an extent, just like obesity to an extent, can be somewhat controlled and monitored with healthy lifestyle changes. But you're not going to shame someone with type 2 diabetes or heart disease for not getting up and moving more. But you're going to shame, you know what I mean? It's the other thing is, obesity is a precursor to so many other diseases. If you have obesity, you are at higher risk for diabetes. You're at higher risk for high blood pressure and high cholesterol. You are at risk, if you are clinically obese, you are at risk for developing 13 different types of cancers.
That's crazy.
So again, this is where I also have a real issue with people saying you shouldn't want to lose weight, just be happy. It's like, well, what if we want to prevent other things from happening? And I really think from a public health standpoint, getting proper obesity treatment interventions in early is the best option, which is, again, why I'm such a believer in also doing weight loss surgery on lower BMI patients who obviously qualify. We're not going to do it on someone who's not obese, but someone who is of a lower BMI obesity range. Why do we have to wait for it to get that bad? Like in your situation, you were at a BMI of 37 and you were pre-diabetic. Should you have waited till you had a BMI of 45 and were full blown, had diabetes and were on insulin? Like, why should you have to wait for it to get that bad?
I mean, according to my insurance at the time, yes, that's exactly what I should have done. That's
100%.
Quite literally what they said. They said you either need to get diabetes or gain, I think it was like 24, 26 pounds or something like that. And it was like, those are terrible options. Why would I do that?
Excuse my language. I hope it's okay to say this, but like, how ass backwards is that? Like, you have to get sicker before we can help make you better. Like,
it's insane.
We can have a whole other podcast episode about the struggles with, the American healthcare system, but it's just, there's just so many flaws and it's so frustrating.
Yeah, it really is. I know we have gone pretty long. If you have 10 more minutes, I would love to talk about plastic surgery and especially your experiences being pregnant after having plastics. Do you have time?
Yeah. I don't hear a baby crying in the background, so I think we're good.
All right. So Jamie, you also had plastic surgery before you got pregnant. You had a tummy tuck. Remind me what else you had.
So I had 3 rounds of plastic surgery. I had a full tummy tuck with muscle repair. There's a standard abdominoplasty and a breast augmentation. And then about 1.5 years later, I had a conversion from the tummy tuck to an FDL, a fleur-de-lis tummy tuck. My surgeon was super upfront with me and had said, hey, I think you'll do best with an FDL, which is the big vertical scar, because of your top skin. I was a little hard-headed and I was like, I don't want the big scar. So we're just going to, I was like, no, I think it'll be fine. He's like, I think you'll be okay, but you could definitely get, do better with an FDL. I should have listened to him. So I ended up converting it to an FDL. So I ended up with the big vertical scar, which healed beautifully. You really can't see it.
That's great.
And because it made sense to kind of like double dip and do 2 surgeries at once, my surgeon will do up to 2 procedures. It was, cheaper. You're already paying for anesthesia and like fees and all that. So we ended up doing a bra line back lift, which surprisingly was a huge, I didn't even think I needed it. And my surgeon, who I love dearly, he's like, you want to take care of that side skin? I'm like, yeah, I want to take care of that side skin. It was wild. They took a huge chunk basically out of my back and sewed it up. So I have a huge scar all around my bra line.
I don't think I knew you had that one. That's so interesting.
So that one made a huge difference in my shape, along my torso, because I no longer had a bulge of skin there. So that was really cool. And then after I ended up doing, so I wasn't planning on doing any more after that. I ended up needing a little bit of a scar revision on the FDL because part of it had opened a little bit. So when you have really large scars, so I had my FDL scar actually starts like between my boobs all the way down to like my pubic bone.
Oh, wow.
And my bra line back lift is all the way around my back. So I had that at once. So when you have large surgeries at once, sometimes you risk a little bit more, you're a little bit more risk for wounds opening because of loss of blood flow during that time. So I ended up having a little opening on my FDL, and my surgeon said, I will, fix that completely for free. We'll just do it real quick. Like, just, it's not going to be real invasive. It's just superficial. He's like, but we are putting you under anesthesia again. Do you want to do something else while we're already paying for that? And I'm like, sure. So we were going to do what he called a mini arm lift. So it was just going to take like a little bit of arm skin. But when he got in there, he realized I actually had more arm skin than he realized. So he didn't charge me more, but he did do the full brachioplasty. So I ended up having the full arm lift when I was only supposed to have a mini, which I was obviously very happy about. It would have looked so funny if he had just taken that little bit and I had more skin down here. So those were the 3 rounds of plastics that I had. Arms, in my opinion, was by far the hardest. I did not do well with the arms. Yeah, a lot of people have different experiences, but for me, the arms were really tough. But I had the 3 rounds.
So which of those do you think is your favorite?
I want to say the FDL and like back lift, but also I really love having boobs. I really do. Initially, like, just like, it was so great. Even as someone who was morbidly obese and almost 300 pounds, I always was like pretty flat chested. I think that was also related to like PCOS and hormones and things. So like tops just never looked good or fit right, or like bathing suits. So being able to like have like my breast augmentation was really fantastic. But I'm really grateful for all of them, even the arms, even though like the healing process was like sucky. The reason I struggled more with the healing process for the arms is you always swell when you have surgery and the swelling goes down. When you're swollen in your torso, like, yes, it's uncomfortable, but it's a different level of discomfort when the swelling goes down into your hands. My hands were so swollen to this day. So my surgeon has operated on me a few times. So I think he tested the waters a little bit because he knew like I'm really good at like post-op care. I follow all his directions and I heal really well. So he told me that he went tighter on my arms than he's gone with anyone else before. And he was actually like a little worried. He's like, he told me at my post-op appointment, he's like, I'm so glad things went great. So I was worried there for a minute. I went too tight. I'm like, thank you. He's been doing this for like 30 years and he's absolutely wonderful at what he does. He actually specializes in bariatric specific plastic surgeries. But that's awesome. He kind of like shows off my pictures to like his other patients and stuff because he's so proud of like how my arms came out. I'm like, well, thank you. I love that for me. But because they were done, like, it was very tight and the swelling was a lot. So the first couple days, I couldn't even text on my phone. My fingers were so swollen. Like, could not bend my fingers, which was not great. Yeah. I didn't have any complications though. Like, totally like fine. It was just super uncomfortable. So, and that was also my 3rd round. I'm like, okay, I'm done after this.
Yeah. I'm so impressed that you did this 3 times. I did it once and I'll never do it again because it was pretty awful.
It's a lot. It's pretty awful.
Very worth it. I agree with you on the boob thing. I was actually standing in my bathroom the other day and like didn't have a shirt on and I was like, oh, those are pretty good boobs I got. Like that worked out well. Because I was the same way. I didn't have, I think some people before, some people like have big boobs before they lose weight and then they lose them and it's really sad. But I never did. I like never had good boobs. And now I'm like,
either.
It's a good set I got there.
Yeah. Love that for the confidence.
Yeah.
I will say after pregnancy, obviously I've gained weight and whatnot. It really hasn't affected the surgeries that much. I'm still waiting to see like how that plays out for the boobs because before, like, I loved the fact, especially when I was at like my lowest and my leanest before getting pregnant, like I could easily wear like a backless top or dress and not need to wear a bra because of like the breast augmentation. Now after pregnancy, I did not end up breastfeeding for a few different reasons. That's another question I get asked is like, can you be on Mounjaro or GLP-1 while you're breastfeeding? The answer is no, but I'm not breastfeeding.
That makes sense. Okay.
But even still, like with the way your body changes and like, the first thing, like when I got pregnant, even before I started really gaining weight, is like my boobs got even like bigger, which was wild. So things are like just different. So I feel like at this point, like I need a bra, but other than that, like those are, like, they're still totally fine. I'm not worried about that. And I'm not worried about that as I lose weight. The augmentation's still in there. They're not going to deflate. So that's great.
Yeah.
And for like the arms weren't affected like at all. Like, I mean, I'm bigger for sure. Like 70 pounds is a significant amount of weight. I think I'm down like 27 pounds since having the baby,
That's awesome.
which feels slow, but I know it's, you know, I'm losing about like 5 pounds per month, which is totally consistent and healthy.
Yes.
I think in my head, I was like, it's all baby weight. Like my baby was 6 pounds. It was not all baby weight. There's a lot of swelling and stuff for sure. But
yeah,
I had to mentally just tell myself it was baby weight to like get through it. But I'm for certain like bigger and in a bigger body compared to where I was, because I was at my absolute lowest and leanest last year. And I say leanest because I had hit a low weight, but I also had built muscle during my weight loss phase, which just quickly touching on the GLP1 piece again, is totally possible. Like I said, if you're good with your habits, if you're strength training, if you're eating well, you can really change your body composition and not just lose all that muscle mass. So I loved that. And that's proving to be to my benefit now postpartum, because I'm back in the gym and things, even despite my terrible pregnancy and the weight gain, things are not as hard for me at the gym now, even after all of that, as they were when I first joined with very low muscle mass. So when I first joined the gym like 4 years ago, when I was, I didn't have any muscle, like it was much harder than it is even now postpartum with some weight gain, because I still have that muscle, which is fantastic. But because of that, like I'm bigger, but my body shape, other than my belly, didn't change too much. So my arms and like my back lift are still totally fine. And even my stomach, I think looks great still. It's like, I'm That's bigger, great. But my stomach is like pretty flat still, despite the weight gain and despite having the baby. I didn't have like that super big round belly. And I think I was limited in that because I'd already had muscle repair. So like my belly shape didn't look like just this big basketball. But the women in my family don't really carry that way anyways. Most of us just get kind of like puffy all over. So I definitely still want to lose weight and get more muscle definition back. And I'm working on it. But my tummy tuck is still like intact. Like,
that's great.
I think like where most of my weight it has been carried has been like my thighs and like my love handle, like hip sort of area, which is interesting because I've always been pretty like straight and narrow, since like losing weight. So now I feel like curvier. So even though I'm in a bigger body, I'm also not like hating it. And I think a lot of that does have to do with like the mindset work I did, but I did force myself to put away old clothes that don't fit, because I was in last summer before I got pregnant, when I was at my leanest and healthiest and built all that muscle, I was wearing sizes like 2 and 4 jeans. So like I was really small at that time. Yeah. After having the baby, I ended up buying a size pair of 14 jeans. Those are too big now, which is kind of cool. So I'm somewhere between like a 10 and a 12, which, is still like a totally a-okay size for me to be at. My goal is not even to get back down to where I was before the baby. Honestly, if I lose another, I gained 70. If I could even lose 50 of that 70 total, I'll be really happy. My goal is not necessarily to get back down to my lowest. That's not even like what I'm focusing on, just focusing on being healthy and whatnot. But all that to say, the plastics are still intact. So I also got so much negativity from people going through plastics. Because at that time, I didn't even know if I was going to have kids. But so many people were like, but what if you have a kid? What if you have babies? I'm like, well, I'll deal with that when I get there, I guess. Because I didn't want to put my life on hold for something I wasn't even sure I was going to choose in the future at the time.
Yeah. I was in the same boat. It was like, I don't even know if this is a possibility. And so like, I want to feel good now. I don't want to like wait years and years to be like, well, maybe I'll have kids. And then like, then I'll do something about it. And the one thing I was concerned about was like, and I asked my plastic surgeon was like, is there any potential negative effect on the baby or like my health? And he was like, no. And I'm like, okay, well, if it's just aesthetics, that could, be a bad side effect of pregnancy. Who cares? Like, I'm going to have a baby. I don't think I'm going to care that much.
Exactly. And it's very different in my opinion, like, and everyone's pregnancies are different and whatnot, but it's very different in my opinion from being morbidly obese and having loose skin from all those years of carrying weight everywhere in your body versus your belly being stretched a bit. It doesn't, I hate the bounce back culture. and being expected to bounce back, but like things just like go back down differently. And this is going to sound like potentially very vain and superficial, but I think it's honest. My weight impacted my ability to enjoy so many experiences in my life leading up, before having surgery. It impacted so many things and took joy out of things. I didn't want, and like I just said, I didn't have like that perfect round basketball belly, but I still had a pregnant belly, of course. I didn't want to have a pregnant belly that I didn't feel could be cute or proud of because of loose skin hanging over it.
Yeah. Yeah.
Like I know that sounds silly or vain, but I'm like, if I got to go through the pregnancy thing, and even though my pregnancy was really sucky and not a whole lot of fun, I'm like, I at least want to be able to have a cute pregnant belly where it doesn't just look like fat hanging over it. You know what I mean? Like that for me, like I was like, I don't want to look big again. I want to look pregnant. So that was another reason I'm like, and my surgeon said the same thing. Doesn't impact anything. The only thing that it impacted a little bit, I ended up having a C-section. So another thing I didn't really touch on, but I did end up developing preeclampsia during my pregnancy, which was really sucky. I was hospitalized a few times to monitor the baby. At 36 weeks, he came early. And at that point, I was like, get out. You are getting evicted. But I ended up, I had a C-section, and it took my surgeon a while to sew me back up. And I remember her and like the other resident that was there were like, just taking a while because you have a lot of scar tissue. So when they were trying to pull everything back down, it was hard for them. But I remember my OB, God bless her, love her dearly. She was like, do you want a second scar, or do you want this over the old tummy tuck scar? I'm like, over the old tummy tuck scar, please. And she said, she's like, her and like the resident who did my surgery were really proud of themselves, because she's like, when I got in there, I realized like the scar was like a little bit crooked, which I never noticed, but she's like, it was a little bit crooked, so we made it straight. It's good now. I'm like, I love that my OB like took it upon herself. So you can't even tell like I had a C-section or anything, because it's right on my tummy tuck scar. Like I couldn't even tell you the difference.
That's awesome.
So it just took her, like, I was on the table a little bit longer sewing me up because it was tougher for them because of the scar tissue, but it didn't affect the baby or me or my health in any way.
Yeah, that's good. Yeah. I mean, obviously being able to have plastic surgery at all is a huge privilege. But I think 100%. If people are able to do it and it's something that you want to do, even if you think kids are in your future, I wouldn't let that stop you from doing it if it's going to help you feel good now.
And I agree. It's a total privilege. I will say, and I've talked about this in the past too, even though it's definitely a costly investment for sure, it doesn't have to be quite as costly as you might see on social media. So my surgeon actually is at a local hospital. A lot of people don't know this, but you can see plastic surgeons through clinical hospitals. My insurance covered a great deal of all of my plastic surgeries because I went through a hospital and they were able to code it as like certain, not all of it, because certain things were just aesthetic, but certain things they were able to code as medical. And my surgeon's costs, like at baseline, even without insurance, were much less. And I remember being like skeptical. I'm like, why are you so inexpensive? And he said, he's like, the hospital pays me my salary no matter what. So like, you're just paying for the procedure. Like I get paid whether, he's not like a private practice plastic surgeon. He's not upcharging you for everything or telling you like you need more procedures than you do. So I actually felt more comfortable with him. And he specializes in post-bariatric skin removal. So like I'll see people who get quotes for like tummy tucks for like $45,000. And I'm like, oh my God, that's crazy. Like,
that's insane.
I one of my clients who lived on the West Coast, wanted to do like a 360 tummy tuck. She had lost over 200 pounds and like muscle repair and maybe like a little bit of lipo. And they quoted her like almost 45 grand. I was like, I would rather you fly here and I will host you for the 6-week. I was like, do not do that.
I went to a private practice plastic surgeon, but I think my tummy tuck was about 10,000.
Yeah. That sounds way more feasible.
Yeah. I did him with the breast lift and augmentation in total. It was like 22,000. So whatever, I think it was about a 50-50 split. So something around there. But yeah, I also got quoted a very popular on Instagram plastic surgery center out on the West Coast. I did a virtual consult with them and I got quoted, I think it was like 38,000 for a 360, which I don't even need. So the fact that they wanted to do that was kind of crazy. But yeah, It
was
doesn't
funny
have to be
because,
that expensive.
yeah, my surgeon had told me, because I went on a few consults in some private, I was willing to go to a more expensive place in private practice plastic surgeon to make sure I was happy.
Mm-hmm.
And I remember one of the surgeons said, like, you absolutely need not just a breast augmentation, but you need a lift. And my surgeon said, he's like, any surgeon that tells you that you need a lift is lying to you and wants your money. I remember, like, he's like, you do not need a lift. And he was so right. I did not need a lift. Like,
Yeah.
So I definitely do your research, but I'll just share here. I shared it before. In total, for all my surgeries out of pocket, I quote, like, only paid 14 grand.
Wow. That's incredible.
Yeah, because insurance
Wow.
paid for a huge portion of, I think, my first 2 surgeries. And then because I kind of, like I said, double dipped there, like insurance was already paying for anesthesia. They already,
I see.
I was paying. So like the actual augmentation and like the skin removal on my abdomen was covered, but I had to pay for like the muscle repair because that was considered aesthetic. So there were things out of pocket I had to pay for. But at the time, my insurance was really good. They covered some of it. And because I went through the hospital versus a private place, they took the insurance, which was great.
Yeah, that's great. And not every insurance will cover skin removal, but it's worth checking to see if yours does, because that makes a huge difference in what you're able to do.
100%, which is still a huge privilege, even with the insurance and all that. But worth noting, just because I know some people are like, that's completely impossible for me. And it might be more feasible depending on where you go or what you get.
Yeah, absolutely. Well, Jamie, this has been so much fun chatting tonight. You have a lot of resources for people, and I would love if you could share with our listeners some of what those resources are and where they can find you and find what you offer.
Absolutely. So the absolute best place to find me is, well, first and foremost, I'm on Instagram. That's the main social platform I'm on, at The Sleeved Dietitian. But anything else you could be looking for, please go to my website, www.thesleeveddietitian.com. On my website, you'll find all of my services, my free resources. I have a few free resources available. I have my free meal planning guide. I also have my blog, which I've been really into lately, working on that. So I have tons of blog posts just for like free information and content. But if you're looking for some more structured services and programs, my main service I offer, and my most popular service, is my Tribe membership. It's an acronym that stands for the Real Insights of Bariatric Eating. We opened our doors in 2020, and it's the best way to describe it is it's kind of that one-stop shop for all the support you can need after surgery. So it is a subscription-based program, and when you join, you get access essentially to my private website, where you have all my step-by-step video modules going through the same trainings I give my one-on-one clients, where I teach you everything you need to know about nutrition and weight loss after surgery. We have tons of bonus modules going over very niche topics like pregnancy, PCOS, vegetarian diets, traveling after weight loss surgery, reading labels. Literally, it's like a whole resource vault of everything you could want. We have hundreds of recipes in there that are all dietitian approved. And we also have hundreds of workouts that were created by NASM certified trainers. So there's workout videos as well. So you have everything just kind of on the app or on the website. In addition, in the membership, though, what's really the best part is our virtual calendar. So every single month, we host upwards of 40 live events. Every month we do up to 40 live support groups. We do live Q&As, we do workshops, I do guest expert calls, and then I have wonderful, wonderful support group leaders, most of whom are professionals. So we have therapists, we have other dietitians, we have a doctor of physical therapy, we have trainers. We also have peer support group leaders, and all but 2 of our dietitians have had surgery as well. So you have other dietitians and other therapists who had surgery. So we have tons of support groups. We have newly post-op, pre-op, we have regain, we have emotional eating, we have body dysmorphia, we have habit planning for people with struggles with neurodivergency. We have so many niche support groups. So while you're going through the resources on your own to understand habits, know what to do to hit your goals, you have support and accountability along the way. So we've supported thousands of people in this program. I do have other programs. I do one-on-one and group programs, which are a bit higher touch, higher level. I also have a couple lower level courses and guides. I have a snacking course. So there's tons of things. So best place to go is my website if you're struggling in any capacity or just want more of that support and community on your journey.
Awesome. And we will put all of those links in the show notes. So if you want to
Thank
find those
you.
resources, we'll have those linked for you. Jamie, thank you so much for being here. This has been so much fun. And I feel like you have such an incredible story. You've had such an incredible journey. And I feel like I learned so much from you. And I just can't thank you enough for being here. I know our listeners are going to learn so much as well.
Thank you so much. I'm so grateful to have been asked to come on. There's not a lot of things I will do past the baby's bedtime, but I was really excited for this one. So thank you for having me. This is a really great conversation.
Yeah, absolutely. If you want to find the podcast on social media, we are at Former Fat Friend Pod. I'm at Maintaining Casey. And as Jamie said, she's at The Sleeved Dietitian. All those links are in the show notes, and we will see you next time.